ano kwamo me kana yade ya yade yentine ni se wotena ma yade bi beto ansa na wape yade hu nimde wentine wasa woje brena hwe health is crucial jumedie a Gym Matters Arising akofa ba ukuada bia nonson ekopem no nwotwe mekire every Wednesday 7 to 8 p.m. ewo Gym Matters Arising Facebook page jumedie isu ne de apomudin dwuma yefo a wakwadre wo apomudin mu be kire yare ahodo ne anu yie anu ti odofo gyebre ne nyina ye mmom nsuade wo health is crucial jumedie so na obefo apomudin to mafra Computers and Electronics is your home of quality computers. We have all types of computers like desktop computers, laptop computers, computer servers, and also computers accessories. We sell in both wholesale and retail. We also do delivery services nationwide. You can locate Danfotek Computers and Electronics at Bombay Bus Stop on the Dakuma Road. Call us on 0246 189 703 or 0500 209541. Danfotek Computers and Electronics, your home of quality computers. Ano kwamo me kana yade ya yade yentine ni se wotena ma yade bi beto ansa na wape yade hu nimde wentine wasa woje brena hwe health is crucial jumedie a Gym Matters Arising akofa ba ukuada bia nonson ekopem no nwotwe mekire every Wednesday 7 to 8 p.m. ewo Gym Matters Arising Facebook page jumedie isu ne de apomudin dwuma yefo a wakwadre wo apomudin mu be kire yare ahodo ne anu yie anu ti odofo gyebre ne nyina ye mmom nsuade wo health is crucial jumedie so na obefo apomudin to mafra You are very welcome to Health is Crucial on this program, which we discuss health. It is very important that you know about your health status or you have more knowledge about health. Sometimes the topic we are going to discuss, you might say that, oh, I don't have that disease or I don't have that kind of sicknesses, but it is good to have the knowledge. As we always say, knowledge is power. If you have the knowledge and probably a friend of yours or anyone who is going through that issue, or in the future, when you have that issues, you can be able to maneuver your way throughout. So it is very good to have all knowledge. And today we are going to discuss a very interesting topic, which is not really common in Africa or in Ghana, if I may say. So it is very good. We will learn a whole lot about it. So bear with us and then be with us as we take you through the next 1 hour or probably 45 minutes, and then we sign out. My name is Nelson, and before we begin, I would like to recommend or thank some of our sponsors. Danfotek Computers and Electronics, they deal in computers and accessories, all types of computers, whether desktop computer, laptop computer, or even computers accessories you need for your work. Just holler them or give them a call. They are located at Bombay Bus Stop on the Dakuma Road. You can call Danfotek Computers on 0246 189 703. 0246 189 703. Danfotek Computers and Electronics. Also, G. Royal Guest House. If you are in Kumasi and you need a guest house, a comfortable guest house to lay your head, look no further than G. Royal Guest House. They are located at Abumaso High Tension, close to the Odio Runabout. You can call them on 0596 098 359, 0596 098 359, or 0596 000 652, 0596 000 652. Also, JA Hair Palace, JA Hair Palace. If you need a best place or a good place to do your hair as a woman, look no further than JA Hair Palace. They are located at Sotium Omanjo, close to the Pharmacy Junction. You can call them, and even if you want them to come to your house to do your hair, they are available. They will come. They do makeup, and then they do anything concerning beautician. They are involved in it. You can call JA Hair Palace on 0270 751 905, 0270 751 905, or 0245 825 321, 0245 825 321. JA Hair Palace, and they give you a very good hairstyle. All right, welcome back to the studio, or welcome back to business, as this is a program called Health is Crucial, where we discuss various health topics for you to get the knowledge and be able to maneuver your way throughout in case you are involved or you experience any of the sicknesses. And today's topic we are going to discuss is occupational therapy. Occupational therapy, as I told you, is not really common in Africa. And we have in the studio two wonderful women. We have Emilia A.T. Tete. In fact, Akweli Tiakua Tete. I don't know if I mentioned it rightly. Emilia. And then also we have Selma Prempe, right? We have Selma Prempe as well in the studio. Welcome, my guest.
Thank you very much.
How are you doing?
Yeah, very fine.
Yeah. And the birthday, how was the birthday?
Yeah, it was cool.
It was cool.
Yeah, getting away from you guys. Even made it more memorable.
Wow, that's wonderful. I believe my kebab is in the bag waiting for me.
Right.
So right after the show, I'll come for my kebab.
No problem.
All right, Prepare, you're also doing well.
Sure. I'm very fine.
Yeah, we thank God. We thank God, and the family, everybody's doing well. We thank God. Okay, today we are discussing occupational therapy. But this is my first time hearing of it.
I wouldn't be surprised anyway.
Yeah.
But
this is my first time. So when we see occupational therapy, what are we talking about?
Okay, thank you very much.
I don't know. This our program is more of she, but when we say
okay.
we are brofo,
so we can. Problem.
Yeah, let's try to mix it.
No
Gen matters arising is global matters arising, so let's try to mix it.
We can mix it.
All right, no problem. You don't have any problem with that. Basically, I'm mixing it now. All right, thank you very much for the question. But before then, I would like to use this opportunity to thank greet my viewers out there, my fellow colleagues, and then all students of Accra School of Hygiene. That is my institution anyways. And then I want to use this opportunity to greet all of them. And then, okay, so back to business. When we say occupational therapy, first of all, I would like to talk about occupation. See, I can't say occupation. Occupational therapist can't say occupation. And I say, if you hear occupation, in our perspective, occupation is our day-to-day activities. From bed to bed. Adi I was sorry no power we till so be sa ko empem. Enti say we can occupation na. Say the yenim ne dada no. Yenim say initially we yenim say occupation here productivity. Our productive occupation like adi a we ya e man with dada aduane and man with sanko no. Adi a we ya we escape room. But when you say occupation to an occupational therapist, it is our day-to-day activities.
Something that keeps you
busy.
Yeah.
Something that gives meaning to life. Idea, like brushing your teeth is an occupation. Sleeping is an occupation.
Okay.
Resting is an occupation. So anything at all, individual it gives meaning to his or her life. It's an occupation. And when we say occupational therapy, it is actually a health care profession, and it involves therapeutic use of everyday activities or occupations to treat persons with physical or mental problems. As I say, so a kind of occupational therapists they use therapeutic activities to treat all manner of persons in order to help them gain independence in their society in our day-to-day activities. So basically, if you hear occupational therapy, that is what it means. Wow. Gaining independence in your day-to-day activities. So in layman terms, that is basically what occupational therapy.
Wow, that's wonderful. Wonderful. Okay. So how do you carry out your duty? All right.
The name itself, the name of the profession depicts its activities or what it's actually about.
Okay.
Like I say, how occupational therapists carry out their duties. We use activities, the activities, and a year interventions.
Okay.
And your clients and all that. For example, let me give you a classical example so that it will be very clear. As in someone who is suffering from stroke. Maybe I'm making no a driver. The person is suffering from hemiparalysis. You can hemiparalysis like nefa ajuju.
Oh, okay.
One side of the body ajuju.
Okay. Is it a mild stroke or is
that
it?
That is the mild stroke.
Oh, okay.
It could be mild stroke and all that. So that is hemiparalysis. If you are nefa ajuju, making any pan or drive it. Nipa ne per se, intin bibisa no. Before you carry on to take care of the person, you have to consider the fact that nipa ne per se or back to doing what he was doing. Return to work. Ti ube view ni na no what come what back into contact with the person, and that is when you are going to plan your intervention.
Okay.
For example, nipa ne sa no person or back to driving. In as much as na nipa ne driver na when you say stroke doesn't necessarily mean nipa ne incapacitated. You get it? The person can either go or return to work, or rather you can find a way to make the person do a different work that will make the person not be a burden upon himself. And even if the person can still return to work, activities being and I would nipa ne firmware. Nipa ne betimi ejina ne naswaye de person onye. Won't me if it's preoccupant when nipa ne kotinaka we say onye driving exercises. So for example, betimi na walking exercises, strengthening exercises. So the beya amodin be ba ne muscle ni mana that part of the body no. So the beya the person oye bi betimi aye. Anase ebia akwala osua atro. What me if it's preoccupant person the same so on. That is why I saw they do scribbling and all that. If be fine motors, working with your smaller muscles and all that. It's as a picking and only a colane beya. O started from bigger objects. If you are the legos a guhonum or peke legos no. We are with the beats. If you are from acacia to get or peke. Into or you're familiar with the picking of every single size of an object. Then you start with how to even hold a pencil. Working with the grass and the grass. Okay. This is how we use activities to do interventions.
Okay, my sister, you have to be here. Is it more of did you add a kind of, let's say, talks like counseling? Do you have anything like counseling in it?
Oh yeah, sure. I think my sister wants to say something.
If it's necessary, we have to, because occupational therapists, one thing that we do that differs from other professionals, we don't only look at your, like, let's say on sire or young, we don't only focus on that part.
Okay.
Aside on family, you have other things you're supposed to do. You have a family, you have a home, like we focus on living now, so we don't like focus on one part. We look at you in a whole, and we have something like holistic approach. Your family, your homes.
And how do you do that? The family, I don't get it. So like then, when you are munyaka sachirana say.
Yeah. So let's say Obi in a stroke. You know, say the family will go into psychological trauma, emotionally, like, because taking care of these people is somehow very difficult. So, you have to come for it. So we have to talk to them to let them understand what is going on, to let them know what is happening to their person. Say, so you try and do this. So they also need this kind of thing. But sometimes, like, one share family members that these things are not and they are not patients now, and also intervention now the Burma patients. In a way, Burma low and a bed bringing it down. So whatever you do because so we mostly do talks when they are necessary.
Yes. So you need to set this holistic approach now. Okay. For instance, even the individual, him or herself now, or what problem, you view the person holistically means you consider the biological factors, the physical, and then the psychological factors. In as much as nipa when you stroke, doesn't mean say a one pet and a way are affected. the very moment I will be being stroke, adrenaline setting in.
Okay, this is what I was about to ask. That has it got to do with only physical disability?
No.
Like for instance, to be the girlfriend be and a boyfriend be and now we now breaking hearts.
Yeah, but who the nina it will yeah,
okay.
It may be a stroke for instance.
For instance.
Stroke in your papa, nipa feels that that's the end of his or her life. It's not and the person starts to think, depression sets in. Nina
like probably someone had an accident, maybe or say amputating a leg and hand.
Exactly. It's a normal talks na yede ben ebemu no because nipa no wanya stroke ni wiase nyina o feel say ni wiase nyina be ye ti no say na sad adwenbi bi beto ne so aside ni stroke no or say adwen depression are setting in ti yare kokoro yare back no fa nyama bebre, but that is why you have to view the person holistically. Consider every aspect of the person's life.
Okay, that's wonderful. So, why is it necessary for one to employ a therapy? Why is it necessary?
That is a very interesting question, and I'm very glad you asked that question. You see, maybe your car, you drive it, right? You sit down, you're dying. Nobody wishes say at ABC, but as nipa no at it is inevitable. That is why all the time you have to plan ahead. That all driver no and I would and I said no. That's why there's something called insurance cover. The person means some kind of example. Insurance cover so we insurance cover now one planning and I said there's no way I wish for yourself to be involved in an accident. But say what is your guarantee? And I said, what is this insurance that will cover you up? It's a hospital, doctor, making sure will save you life.
Yeah.
We always say doctor save life, but occupational therapists, we help you live it.
Okay.
What save you life? A doctor will not leave his or her patients at the hospital and come and teach you how to mobilize yourself around your home after injury.
Yeah,
that is when occupational therapists we set in. When your accident, ebia amputation, why ya na say ebia care no the amount, or making sure say pain and everything. That is when we come in. You are wheelchair bound. What is wheelchair? Doctor make sure how to maneuver yourself around your home in the wheelchair or with the wheelchair. That is when we, the occupational therapists, we come in. So we consider certain factors, environmental factors and everything. See, you feel more no crown. It is up to we, the occupational therapists, to do environmental setup and all that. It is said, I'm going to say, switch a body, switch the water topper. They say, and you are wheelchair bound. You can't, and then they will be able to turn on the light for you. We have to position it in a way that so be any fear you can stretch your arms and turn on the switch. So occupational therapists, we are needed not only in hospitals, in factories, schools, everywhere.
How is it common in Ghana?
Common in Ghana. Okay. Recently, it's been few years since it was implemented here in Ghana, but it is well known across Ghana and across the world. I mean, different countries, but Ghana here, it's not been very long. And I think we are reading the diploma in occupational therapy, and we will be the fifth or fourth batch.
Okay.
Yes. But it is the degree aspect is in University of Ghana. It's not been long since it was established.
So
yes.
Meaning few schools does it.
That is so far. For now, it is 2 schools.
2 schools.
Yeah, School of Hygiene and University of Ghana.
Okay.
And I think Allied Health. Yeah.
And how do you work? Is it a hospital that has to employ you to work there, or you can be employed at home?
I think my sister wants to come in.
Okay, so with your question, thank you for the question. One, the hospital can employ us. Again, so we can be posted by the government.
Okay.
And then again, we can be self-employed.
Okay.
Because occupational therapy, it cuts across everywhere. We work with everybody, no matter who you are. So then you can try to work for yourself. We are mostly being posted for my place.
Okay.
Mostly being posted by the government. But since we are not many, there are not really a lot of occupational therapists around the country.
Okay. Is it expensive to hire one?
Oh, it's not really.
Oh, it's not really expensive, but you have to make us feel. Because the work is not easy. The work is actually not easy. It is not something that you can just look in a book and then prescribe something for a patient, because we are unique. Human beings are unique. So what me home now or hemi paralysis now me know ye working exercises. It doesn't mean just a way so and Mrs. Taba me home so the same approach and the you have to view the person. So you are always learning.
So how different are you from a nurse?
We are very different from nurses. Very different from nurses.
Like
we are more into rehabilitation and habilitation. When we say rehabilitation and habilitation, it's like with rehabilitation, helping someone to learn new skills. And the rehabilitation, helping someone who used to know something to relearn what he or she used to know already. So yeah, the end is basically about activities, helping the person with day-to-day life. That's why I said occupation. But you know, nurses are more of self-care at the hospital and all that. Yeah, no, we do self-care. We teach self-care. But nurses, they do self-care or they issue self-care to patients. But we don't only issue it to you. We have to teach you, because you can't live with me around you all the time.
Oh, okay.
You need to be independent. Yeah.
Oh, okay. Do you do with the, let's say, mental disorder? If someone has mental disorder,
We have pediatrics, occupational therapists. We work with pediatrics, geriatrics, mental, and then physical. With the pediatrics, this is a very sensitive part that I have always been wanting a platform to advocate this to the general public. Why am I saying this? There has been this saying, or any mental and or any special condition, and then you have to be in sober. So I'm not trying to, compare, spiritual something to our profession, but I just want to be tactical, or I just want to be real here. Like, due to one or two reasons, problems, and then you conclude so you're sober. There is nothing like in sober as far as I, an occupational therapist, is concerned. But there is something called neurodevelopmental disorders. There's a lot of things that goes on in the womb or in the stomach of a woman. A lot of things. Maybe ACC development, brain formation, something happened and all that. It's when you come exactly, and then spinal cord. And I must say, it's the brain that controls the heart. Without the brain, you are nothing. And say brain now for me here, you can imagine. It is a orthopedics. We work with kids with cerebral palsy, kids with autism. Autism is actually a spectrum disorder. Kids with attention deficit hyperactivity disorder, also known as ADHD. And then kids with Down syndrome. It's a lot. You get it. We work with all intellectual disability, learning disability. We slow learner and all that. And then you conclude
how do you do that?
So now, that is what I'm saying. It is a very special profession. It's a very broad profession.
We get time for them to.
Yes.
So we are like slow learner. Why never So we have to get someone and then those people, it's not like we're born to now. But then if I'll take a dress now.
Yeah.
But then no, I bet you I just the way we pity. That's what so I development 6 years. Obi wa kwala on my 6 months and I said people now an answer.
Yeah.
Obi 1 year kwan so be nancy. That doesn't mean say so kwala na nancy be man answer. So sometimes it's about we getting time. And I think they are professional. We have to make time for
and sometimes to ignorance and also contributed to it. Obi wa ho no ma o si mi someone nantentum. In the banner when you 2 years, 3 years, 190 years, who say is normal. Mi someone kasantem. Who said the banner nya 3 years, one can say normal. No, it's not all of them that is normal.
Oh, okay.
Because especially with the autism, for instance, Obi akrabi be CDD, that is a part of the spectrum. Childhood disintegrative disorder. Akrabi one only know to make us he's or she is very fine. But very much age 3, it's normally between age 3 and 4. Nakasa nateko. Disintegrate. Instead of so when you na kone ni no neba nechi. Na when say normal na oh miswana man kasante obi won so won yin no emma. or me them this one man sometimes so meaning na ignorance so no
Okay.
so in as much as someone can sometimes you support a beer what to say no you need to seek for medical attention. Let a doctor or yes a certified doctor diagnose that. You can't diagnose it on your own, you get it. And now when you come to geriatrics, that is another phase of your profession, how what we do, that is with the aged. Aged with osteoarthritis, rheumatoid arthritis.
Okay, with the aged, we will come there. But I think we will go for a commercial break. But before that, let's acknowledge some of our viewers. I think Amanda Asamoah is watching. You can also put down your comments, please. If you are watching, you can put down your comments so that we will read them, or probably any question you want to ask them, the experts. You can put down your comments and then we'll read. Eunice Eyonam is watching, and also Nana Adwa Isel also watching. Kwa Bena is also watching. He said, Mommy and Emily doing the most. Wow. I mean, that's your people. And a nice program, Doctor. Yeah, I mean, it's all going to our wonderful guest. And then Nana Adwa Isel, see fire. And then Kwabena, see OTT, Salma, and OTT, Emily, love. And then he's saluting you also. Nana Adwa, see, my guests are doing the most. So this is all appreciation to them. So we'll go for a commercial break and then we will move to another section. So let's go.
Danfotech Computers and Electronics is your home of quality computers. We have all types of computers like desktop computers, laptop computers, computer servers, and also computers accessories. We sell in both wholesale and retail. We also do delivery services nationwide. You can locate Danfotech Computers and Electronics at Bombay Bus Stop on the Dakuma Road. Call us on 0246 189 703 or 0500 209541. Danfotech Computers and Electronics, your home of quality computers. Ano kwa momi kana yadie ya yadie yentine ni se wotnoma yadie bi beto ansa na wape yadie ho nimdie wentine wasa woje brana hwe health is crucial jumedie a Gym Matters Arising akofa ba ukuada bia nonson ekopem no wotwe mekire every Wednesday 7 to 8 p.m. ewo Gym Matters Arising Facebook page jumedie isu ne yede apomudin dwuma yefo a wakwadre wo apomudin mu be kire yare ahodo ne anoyie anu ti odofo gibrani nyina ye mmom nsuade wo health is crucial jumedie so na obefo apomudin to my fra.
Right, welcome back to Health is Crucial on Gym Matters Arising. As I told you today, we are discussing occupational therapy, which we have delved into so many things that needs to be taught, and we are learning a lot. We are learning a lot from our wonderful sister Emily and our wonderful sister Salma Prempe. So we are back, my sisters. As we were leaving, we were about to talk about the elders.
Okay.
I know somewhere in other countries, you hear these people saying, "I'm going to the abroad to do nanny work. I mean, take care of elderly." So,
Exactly.
what are your rules in such people?
All right. So, with the geriatrics, it talks about caring for the aged.
Oh, okay.
Yes. So
The word is
geriatrics.
geriatrics.
All right. That is caring for the aged.
Okay.
Some of the aged, excuse me to say, death is inevitable. Yes, so sometimes you just have to care for them, make sure that they take care of their self-care needs and all that, even before they lay in state, they go to rest. Exactly. So with them, some of them have conditions like the rheumatoid arthritis, the osteoarthritis, the Parkinson disease, the Alzheimer's. They are all associated with aging.
Okay.
You get it. So I'm sure you don't even know what Parkinson disease is.
I am confused. I am confused.
It is actually about tremors in the hands. Some of them, when they get older or when they grow up, you realize that they have tremors.
Tremors.
Symptoms of Parkinson disease
Okay.
and Alzheimer's. So some of the characteristics I repeat. Obetini aka say say ya guys one dey can organize one kind.
I repeat, I am right here crying. If you are due.
Where is one kind? Yeah, memory loss and all that. That is the Alzheimer's. Need nice associated.
What are the causes of memory loss?
Causes of
memory
loss? You want to talk about it?
Okay, so sometimes when you're aging,
Okay.
some of the cells in your body, like or how it works when you're young, is different from how it works when you're
Aging. Okay.
Some of the cells they die off and all that, so you don't expect it to be like
Okay.
yes.
So that's why
It's very
forgetfulness sometimes happens mostly in the old.
Okay.
because as you age, your system begins to deteriorate and all that.
Even the
skin changes. It's a lot.
Okay.
All the body systems begins to have its own issues and problems.
Okay.
That's it. And then we have the physical.
Okay.
The physical talks about patients with bends. You have contractures.
Okay.
If you or recover, you need to work on that particular patient. Yes, as a if you base on the pain, you will not treat the person.
Okay.
That is why pain management and all that. So that you have to treat on it to make sure the still have mobility and a range of motion. The joints and everywhere are working.
Okay.
You get it. It's another standard. Also physical, so it includes orthopedics.
Okay.
People with fracture, club foot, or their feet. The sole of their feet are done. Now, and all that, and then stroke, they all fall under physical.
Okay.
Yes.
With the physical, does your work involves in the massage, like?
Yes, before it's all parts. It's all parts because making the person is up. Sometimes you have to do passive mobilization, like mobilizing the joints and working around the joints, mobilizing everything, and then sometimes you have to massage even the muscles before any other thing. You can't just go on and I will be when you're twisting the leg till there's a swell. Edema sets in any effort at home, and like inflammation. It's a honey, you know, what you change, said the baby, aswani, you pull it off to the lymph nodes before and sana ebia obey bandaging and all that. While into massage, you can't escape it.
Okay.
Therapy.
With burns, our muscles work in such a way that if you say it's mere stuffing.
Okay. If you are not moving it for a while.
Yeah.
Okay. This is sometimes okay. So move it's mere then so then. Obina burns na ebia ne hand na and you don't mobilize the sano, you don't do anything. Not more dressing, the necessary dressing. Everyone say like before a cool move, none in Sana,
that's the contractions.
A movie and a shame. So then, like I was saying, even in the pain, you have to move, then you move. And had so that Moja bits me float to that. Because Moja and Kohoma, then and yes, shame.
So in that case, then anyone that has an accident and after the hospital treatment, that person will need therapy.
Exactly. That is why I'm saying that OT is supposed to be employed anyhow. It's
supposed
supposed to be common
that you can get it in any hospital.
Oh, for now, by the grace of God, it is coming out. For now, we are at Rich Hospital. You find an occupational therapist. 37 Military Hospital. You find an occupational therapist. For Lebu.
So these are government hospitals.
Yes.
How about the private ones?
Private ones need
Even the government one.
That is it. It's not like we advocating. This is a very good platform for us to advocate because all hospitals across Ghana needs an occupational therapist.
And because, like, let's say a hospital back home, not necessarily then over occupational therapist.
Anyone, not even.
What I say, it is very pathetic. It's nipa no for so wasani yare nipa ne or TV wheelchair mu or no sadi yare for because on 19 or TV wheelchair mu or why excuse me to say like a vegetable. What if I that is not what human beings are supposed to do.
Well, the more concern is where you are talking of encouraging the person that no matter the situation, she or he can do something.
So
because sometimes the mind side and we sit down and then do nothing, and some people even end up begging.
Exactly.
But
which is very
I know one guy.
It's
I know one guy
wrong.
who is in a wheel and he does repairs of electric iron and stuffs.
That is supposed to be something, and it gets your mind off thinking. So and all that.
Yeah. And I think this weekend I traveled with my father, Nite Kutegu, and I saw this guy. He was really happy. I was looking at him. He was in a wheelchair, and I was a bit, I had a lot on me, so I was very quiet and I said, my shit. I'm thinking a lot. How to do this? How to do this? So I wasn't happy. And I see this guy in a wheelchair. He was very happy, moving and then jumping, and I think he was taking this susu or something like that, saving. Yeah. So he comes to this shop and then he's taking your susu and then mark in a wheelchair.
Exactly.
It was very happy.
And you know, in as much as we're impaired, we don't call them disabled. A lay person will say the person is disabled. If you say someone is disabled, the person is unable to do anything at all.
So it can be that your legs are there, your eyes are there, but
disabled. Exactly. you don't have eyes, but you are able to do what you want to do. You may be disabled or you have disability in seeing, but it doesn't mean you are disabled. In as much as you don't see,
able to do something.
Exactly.
Yeah,
so we don't call them
I think we have these people called Royal Sparrow or something. They sing, they play music, and I mean it's so wonderful.
The only part, the only part but it doesn't make it, so we don't call them disabled. We call them physically or mentally impaired people.
Okay.
Yes.
One thing our profession focuses more on is making someone independent.
Okay.
That's what one thing we focus on. And then if you want to look at someone, we ask you, we have a conversation with you, what do you want to do? How do you want me to help you? So that's why that's when the occupation sets in. So we ask you what you do from the time you go to bed or you wake up from bed to you go to bed again. Then we ask you what is the most important thing that you feel that this thing I need to do it myself in as much as I'm not able or I'm not able to do anything. Then we try to focus on that part and we try to help you to gain your independence. So we mostly focus on independence. We don't want it to be a burden on someone else.
Okay.
So that's what our profession is mainly focused on.
Okay. Yeah. Okay. And is it also to make the person think, at least I have someone to talk to. Like for instance, when you think everyone has rejected you, maybe your friends, peer pressure, or probably let me take it this way, maybe a boyfriend and a girlfriend be a jail, and then you're always in the room alone and you needed someone to talk to.
Exactly. That is mental part of aspect of occupational therapy. So maybe what make us say your pedics, your geriatrics, your physical, and your mental.
Yeah.
Then you know falling in mental.
Okay.
So with the mental we have schizophrenia.
Oh, okay.
We have depression.
We
have bipolar. We have anxiety.
So what's the bipolar? A friend of mine was saying this.
Bipolar, then I am interested, but I feel like the way we be saying what is bipolar. Tell you what bipolar is.
Okay, so with the bipolar, we have two
episodes.
Yeah, we have the manic and then the depressive.
Oh, okay.
With that one, with the manic, I say the person becomes hyper. Obetumi or because obetumi ache, obetumi ache ne cars, obetumi akasa no obet.
Obeye critical, obeye that is the
Wait, are you on 05? I don't know. Are you listening to me? 05. Oh, there you are.
And this way she like obia bia won go dey say kasaka.
As I say, be our smoky and our taking
never
in any
that
substance.
is one funny and then one very very important aspect of it. When you see the person in its when his or her manic state, it will surprise you. So neja padi ekwa betini atamache at that state. That is the manic and then we secret to be our catcher and a I'm telling you.
Wow.
Not because Nipan was shut down. Sometimes if you don't get a chance to witness all these things, that's will be you may think Nipan was shut down. You don't know how it works. The brain, the brain. Respect the brain, honest.
That's a lot.
Respect the brain.
When the fairy folk out, we do what?
Yes.
But then with the depressed stage, you know, almost some, they don't talk.
Always not shut them, sir.
Like that one. That's
Always not shut them. Sometimes he doesn't want to talk to anyone.
Anybody.
That is someone they can also have the two. Until they know that it's me depressed and not shut them. The manic state. And then there is one funny perception about mental problems. Sometimes, and I've been hearing a couple of people say like, "Obi a mental problem or misbehaving or free mona say like onya relapse or misbehaving and all that." Na if your number don't know be stable no or can you it's never true. If I have mental problem and I have relapse, if I am stable, I remember everything I did.
Oh, okay.
They know what they are doing.
So it's not like you are unconscious.
And it's not like at that moment, you know, what the brain is telling you to do is what you are doing.
Okay, so the brain is controlling you.
Exactly. That is what I'm saying. We initially we all view heart to be the one thing or one organ that holds the whole body, but I tell you it's the brain. Which even controls your heart. It is the brain that tells the heart to stop beating and it stops beating.
Wow.
Exactly. Wow. So Nipan at that moment the adrenal catching they say that is what it is doing. It is if it is he or she is in its manic state, you can't control the person. You can only give the person antipsychotic medication to calm the person down, make the person stable. It's where stable. What's Nasia or doing everything he or she did that. That's what catch your side did that. Don't take it for a fact. Say that one will be our body. It is a mental problem. It's not like the movies we watch. Movie, but they know everything.
We watch there. And last time a friend of mine was telling me that the way we frame mental disorder is very bad. Like for instance, the movie will show that before and
yes, you don't have to do something bad before you have psychological problem. No, it is the brain.
So that is why we don't have to reject such people. Thank you.
Also, initially, if you listen to the history of mental health, you realize that initially they used to treat them like prisoners. There was a perception about them saying, who a mental problem is either you are cursed or you are being punished by God. That is the history. I don't want to go there, but history behind mental.
I think in North we have a camp, witch camp.
Exactly. Look at this. Ignorance.
So sad.
Very, very sad. But that is why we are in a technological world. We are learning. The world is evolving.
I think
all these things are superstitions.
Like before,
myths. You get it. Nipa no, she or you're conscious at that moment. It is what the brain is telling him or her to do. And then and schizophrenia for one also more delusional thoughts. And see, excuse me to say, those we see on the streets, all of them, on a schizo or bipolar. Most of them are schizo. They have hallucination, but they hear things. When you say someone is hallucinating,
so someone can hear things.
Yes. That is to them delusional thoughts. Obi also so the moment I've been no afar or the Bible.
They hear in real voice.
Yes. That is paranoid.
Is that not spiritual?
It's not. Exactly. That is what you would think. You see, because you are not abreast with all these things, that is what you would think. Okay. But I'm telling you, it is not. It is real. It is very real. Some of them too are substance abuse. So schizo is very serious.
It's very serious.
Hallucinating. Take it to her saying, Obi or schizo no to her say. To honor no to them, or to you to them, or to honor no nam forest. That is hallucination.
Okay.
And a delusional thought me or to one of my ass or new because something is talking to the person. And no be to me committed suicide no. Fadi way harm yourself. Do this to yourself. Do this to yourself. And a paranoid me who as a threat. I said delusional thought ne paranoid it goes together.
Okay.
When you're harming. The moment and you when you know. That is why you don't have to mostly joke around these people because
recently they killed I think a young boy.
Yes. Because of mental problems.
Because
the person has this in the constitution law. No, there are 3 people who don't commit crimes. They are one mental persons who are not conscious. Age Akola under 12 years, and then someone with mental problems. It is if you joke around such people, or Wahami free, you get it. So that is occupational therapy. Mental health is one aspect that we really deal with.
Okay. Whoa, wonderful. This friend asked this. I don't know if it makes sense. Viper, let me see if I can get his message. Viper asked this. It's so funny. He said the people we see, like the women we see at their offices and all that, they are therapists to us. I'm trying to get the message.
I don't get it.
I'm trying to get the real message. Let me see. Let me get it. Viper. The name is Viper, right? I should get it. Yes. Yeah. He said the people we see around us, they are a kind of therapy to us.
The people we see
around us. He was specifically saying the women. I know by now he's watching.
Women. I don't get it.
When we say therapy,
do you really understand the question?
It means that like helping someone to be relieved from pain or something.
So that is what he was trying to say. That.
So if he's saying that being a therapist, but then you are not educated to our field, so you don't know. Yes, you don't know how we help people. That's why we say we mostly use activities, your daily activity.
Okay.
To help you. So it's not every therapy that you say that. And then
therapy necessarily means anybody at all can be a therapist. That is why we are saying maybe they are therapists. I don't know what therapy is, but we are occupational therapists.
This is your message. So, and even what you are saying, I think everybody has his own condition. So you can't just, maybe if you have this one knowledge, you can't use it to treat everybody.
Exactly.
That is why you need to be an expert too.
Yes. That is why a physiotherapist will come and make sure there's function and mobility. But we make sure that you are able to do your activities with that particular part of it. And to say, physio back.
So, like I wanted to ask, so what's the difference between the physio and
that is a serious conflict because yes, it is. I'm not surprised.
I think it's the same.
Normally, there's a slight difference.
That's
and
why
normally we work together.
Occupational therapists I've never heard, but I know there is physio.
Yes. Physiotherapy, physical therapy.
Oh, okay.
Making sure
so
that
deal with the physical.
Yes.
Okay.
Physical being of an individual, broken bone. I can see.
Okay.
Like strength about muscle and everything. And strength about muscle doesn't mean say, when I know to be the episode. Sometimes there's a mentality to be open in anyone, and I say when you're fractured or an accident. You're healing no, but of a so far as when you have a problem, it means that particular leg won't be fine. And you can say stressing or no strength above. There is no edema, there is no pain, there's nothing there. No, you have to make it work because the more you work with it, the more it becomes better for you. That is when we are committing it. If you're not man, I can't see our making sure it's strength above. It is up to me to make sure that you are able to do your daily activities. They're not a part of your body. They're not with you. Okay. Physio no can see no area when who says they say there is no edema, there is no inflammation, there is nothing, there is no fracture, there is no dislocation and everything. On where we say why we are not pain in where we be on road, so with me denante. like what me di one sunny didi. So what me peja one across road the back from doesn't mean so did you and when I say but we want you to be independent. That is when OT comes in. See, we are basically for activities.
And then
Your day-to-day.
my sister made mention of the brain telling us what to do, or is the part that controls us. Yes. So let's say I'm here, my legs are like this, and then I'm not moving, or I'm not telling the brain I want to move my leg. How will I be able to move my? So sometimes when they put strength in your legs and then you don't move it, the brain will not be able to know that I have to move my. You have to do something for the brain to know that I have to move my leg.
School cry is and dear cry and say teacher need show a no one can revise here. You will forget it. You have to constantly do it for it to the brain to adapt to it. So you have to teach the brain say I was saying
that is why even if I'm going to my house, this is very funny, but I think it's on comedy. He said there is a way he has been using always. So when he was trying to use another way, then the brain is standing like pass here. I don't know, it was like a shoe. The shoe is so familiar, one shoe. He has been using for a while. So the shoe is so familiar to the road. So when you are passing here, the shoe is directing you here. So even when you are going to your house, or probably you are driving, the brains know that you have to turn left.
It's not sometimes me kata when you say that. I say, oh, na. Wakata when if you what do when you calculate, you say, if you want to win, but what do when you share? Wakata when you now take it about 3-5 steps. And yet we say, what do that now? If you got you want to test yourself, it's the brain. It's in the more we are, the brain registers it. The more we are taught to us on an aka, the brain in every 7:30 be a upeja when I sorry, and all that it captures it. It's in our own dream before. Metiasi and make us a man dream once and me pajamas.
Okay.
So I see. But
it is the brain is very fast.
It is very fast. Electrical. It is very very fast. It works. It doesn't just work as it passes through process before you even begin to talk. Yes. Wow. It works very fast. So
I think we will have a special time for the brain.
And then I
think we will put a diagram on the screen.
Yes.
But you bring a presentation.
It's a whole course on its own. Anatomy of the brain.
Wow.
Honestly, the brain is
that's the
very
anatomy of the brain.
Yes.
I think we will do that someday.
You have a problem.
We will do that someday. Yeah, your brains are very funny. Oh my God, yeah. I'm enjoying this. Wow. This is so wonderful. Family, our time is fast, friends. Very soon you will end this. But when we're talking about the brain, sometimes I go for night duty by work. The day I'm even off, there are times I can even wake up now. Say, if I say probably today I don't want to go early, so I will set the time ahead, and then probably I set the time ahead. I'll wake up early, and then before even the alarm comes, if it is 2 o'clock, I wake up and how is that possible?
That is what we are talking about.
You've done continuously.
Yes.
So at what time say you have to wake up?
It is on your conscious state. It's the moment, and it's that 1 hour to that particular time because that time is for crabbing. That is how it works. Because you get it. Yes, that is how powerful the brain is. Yeah, it is what it's internet. There is a saying that the opposite way you know what the two when you say you can't do it because you have to. The over capture and the over try the brain to do. That is what it adapts to. Yes. So the brain works according to what you teach it. The over train and I don't know babe. And so far as I use every 7:30. Unless you are under the influence of maybe aphrodisia or you have been intoxicated, yes. Yes, if you're in your conscious state and all that, you sleep and even 30 minutes at the time. Sometimes, so I'll bet you when you are
intoxicated or probably taking some substance, does it stop the brain from working?
Yes. No, I understand. Any, let's say aphrodisia, maybe I'm making sleeping pills. At that moment, it shuts the brain. Yes, so it puts it at rest. No new nerves are working and all that. So that is how the brain works.
Whoa, this is so wonderful. Family parts, I'm really enjoying this, but the time is fast spent. The time is fast spent. This is how to crucial, and today we are discussing occupational therapy. Occupational therapy, which we have learned so much. They said you can do everything, no matter the status or the condition you are in now. You can do everything. But before we go, I would like you to, give some advice, one of each of you to advise someone, like, I've always said there is a friend of mine who died. He married less than 1 year, then the guy died. And this occupational therapy, as you are saying, we didn't employ. We Ghanaians, we don't know that, and all we say is, and then we forget about it. But of late, we see the lady behaving funny. We see her behaving funny sometimes. It's like, and also I have this friend who
affected her.
But right after consoling her, and she said they have been taking anything like this, employing this occupational therapy for her to, to psychic her or counsel her. And of late, she behaves funny. And I have also this friend who, I think she said she got married and then the husband likes sex. And anytime the husband wanted to have sex, he probably put a knife. He say, "What? Why am I having sex? I will stab you and all that." So I'm also in mental depression, and after I really good and cry, when she's there like this now, open see another dimension. Such people, how do I advise them to take a step to employ themselves?
You want to talk about it?
Okay, so first I'll say that sometimes we have to learn to share our problems. For all you know, they have a lot of things going on or running through their minds, and they're supposed to share with someone. And then since they're not sharing with anybody, they are keeping it or accumulating it in their mind, and in a way it's affecting them. So if we learn to share, or even if you don't trust anybody, just find one person, or like the occupational therapist, because every profession has a code of ethics, and we have something like confidentiality. There's no way you are going to tell us something and then the next party, even my colleague, will know about it, unless you've told me or you've asked me to tell someone.
So that's why you need the professional therapy. They will probably keep yourself.
Exactly. So confidentiality is part of our code.
So if you talk to them about it, in a way, it will help reduce your pain. There is even something like one share, one cow area, so if you are able to share with someone, and it's nipa say, "Oh, then let me go this way and try to help you. Let me do this." But then if now the show, not the cloud, it will definitely bring you down, and in a way, one way or the other, you have a mental problem. So
how early do you have to share that your issues?
Immediately. It's very difficult.
Was a child,
yes,
when they're in depression, because when you were talking, you said of the you said that word, the depression, whereby the person I feel your best them didn't have points in country.
That one is actually bipolar. For the bipolar, that is its characteristics, and we have depression itself as another mental problem as a result of. That is when the broken heart and all that disappointment and all that comes in. Broken heart doesn't necessarily mean say be a relationship. It will be a disappointing and will be crying your heart is broken. Like, yes, so and will be also a friend be anxiety. Will be on stroke crowd. Or do maybe a nipa one who bet me a that is all part of anxiety phobias. The person can pass out. The person can behave some way. It is in stages. You get it?
We should know that Obiani the way will take you Nyama. Maybe like me so damn fairly because maybe my psychic margin say, "Oh, Obia is say." But then Obi on my I take it to an be too on the person is very emotional. It's a baby bonus simple. So that's why like I'll say again, say be too try and then talk to someone about it. One person. The person will be better. Obi a unim the cry can discuss with the person because sharing something with someone It's not easy. Yes.
But a problem shared is a problem half solved.
Okay. You've talked about you sharing your problem. Also, tell us how should we relate with such people?
With
When
such
we relate
people
with people.
with
Uh-huh.
mental problems and all.
Yeah, or probably someone who is going through something.
All right, thank you very much for the question. But sometimes when you know someone or the person is going off track in thoughts and all that, you can get closer to the person. Sometimes you shouldn't always wait for someone to also build trust in you. Help the person build that trust in you. You can cause someone to have confidence in you, depending on the kind of care you give to the person. You are being so considerate, you are really being so concerned about how the person is behaving and all that. Try to show care, and trust me, the person will come out of him or herself, or like her all, to pour out her heart. And the moment you say what bothers you, like it reduces your or it deburdens you. You get it? So Emma, yes, Ophelisa as a be free. So me, I will entreat such people to, like my sister said, have the courage to confide in someone. You need to see a therapist. You don't have to go to section. You can go to the hospital, see your doctor. Tell your doctor to refer you to a therapist. Talk to her or him, and trust me, you will be fine. And then to all my, impaired people, the impaired people out there, disability does not mean inability. The fact that you are disabled in something doesn't make you unable or unable. You can learn and you will know it. Yeah. So you don't have a problem. Just believe. It's all about believing in yourself. I always say that you control your own power. You have your power, your destiny in your hands. You tell it where to go. God, I'm sure God did not create us or create you to be physically. God knows reasons why certain things come upon some people. And say because like there is nothing like you can control your destiny. You use your brain, and then you can get to where you really want to get to. It's all about determination. Yeah.
Wow, this is so wonderful. These are our sister, Sama Prempe, and then Emilia Atiakua Akweli Tete. And it's so wonderful today. We've learned a lot, really a lot. Let me see if we have some messages here. Those watching, let's see if I have some messages here. We've really learned a lot today. Occupational therapy, and then they've said no matter who you are, no matter the situation you are in now, you can still do something with your life. And it is also best that you discuss your issues with others so that you can be helped. And they made us understand that no one is useless. No one is useless. So let me see. Kwabena, say Mommy and Emilia are doing the most, and I think I've read this nice program. Dr. Amanda Asamoah, Nana Adjoa Fire, OTT, and then Nana Adjoa Isel. My girls are doing the most. Wow. And then Eunice Enyonam, we are proud of you. And all the love emoji. As I saw at Sohono, we Enyonam. And then Janet, and so they say, continue to make us proud. Oh, that's wonderful. And then Mariam Abubakar, I say, my girls are doing well. We are proud of you girls. Wonderful. It's from Mariam Abubakar. And then Nana Efia Asantwa. I say, wow, very educative. Wow, we've really learned. And today, this is where we are ending the show. And as I said, party. Okay.
Exactly. We are from Accra School of Hygiene.
Oh, okay.
Yes. Okay. We are really known for 3 programs.
Oh, okay.
We offer 3 different programs.
Okay.
Apart from the occupational therapy, we have a program called Occupational Health and Safety. Wow. With them, they deal with workplace safety, ensuring safety in your workplaces. We And then even then, it's not even far from occupational therapy.
Oh,
With
okay.
occupational therapy, we also consider certain things about safety,
Safety, okay.
workplace, like ergonomics,
Oh, okay.
like how certain position at your workplace is, so that we preach about prevention of certain conditions.
Yeah.
But yes, it said that the water than being
being
you need to, exactly. So with the occupational health and safety, they are more concerned about safety in your workplaces, putting the correct and then good measures in places to make sure that your safety is assured in your workplace in order for you to live or work successfully without any complications. And then we have environmental health. They are more concerned, when it comes to sanitation and the environment.
Oh, okay.
In those times we used to call them the tankers.
Tankers.
Yes, we call them the environmental health. Trust me, they are doing massively well.
Wow.
Yes, these are also programs we read in Accra School of Hygiene, and they are wonderful programs. I just hope you will invite us again. Maybe they will also love to come. You have to, because there are a lot you need to know about safety and the environment. Yeah, so
okay.
Exactly.
I remember one company I was working with. Anytime they will give you a contract, you need to provide safety statement. How you bend down to lift the metals, how.
That is economic.
So I think you
But
now we don't do that.
We don't.
You see a construction man without gloves.
We
Construction man without helmets and all
helmet.
those things.
We overlook all these things, and it is very, very important.
Sometimes the goggles you have to put on, they don't.
In as much as you are responsible for your life, you will be held responsible if something go contrary. You get it. So if you commit suicide, I buy because you don't owe it yourself.
Yeah,
You get
I think we have to learn a lot. We were this all night. Every day we are watching like.
Yes.
You feel that
you need certain
the complications.
but
complications as time goes on.
You will get
May
to
not
manage.
contribute to aging, certain things associated with aging.
So if you live well, when you grow, when you age, you will not face this kind of challenge.
It's
But then
much.
if you don't live well,
Yeah, won't do baby, no any problems. Look at the lights, and then when you see all these things. Yeah, so it's please you really have to invite them here. You will learn much.
But before you go, I would like each of you to put your number. Maybe someone will need. There are some questions. Maybe the person couldn't get chance to ask, so that the people can call.
All right, so you can call me. Call me on 020-1865-118. 020-1865-118. And you can also WhatsApp me on 0552-141-903. That's my WhatsApp line, 0552-141-903. Yeah.
Okay, sister.
okay, so before I share my number, I want to send greetings to everybody who is watching and then thank them. Especially my mother, my brother.
Yeah.
Yeah.
Aite. Yeah, that guy is crazy, but I love him.
I want to thank him for the birthday wish yesterday. Like, I was very impressed.
We will sing the birthday song before we leave.
And then to my girl, today is her birthday. So happy birthday, Benedicta. I'm so grateful to God for your life. And tomorrow is actually my daddy's birthday, so I want to wish him yes. So happy birthday, Daddy. And God bless you.
You didn't mention the
I
name.
have to thank some
Ishmael
people.
Tete. God bless you for, and then I thank him for how far he has brought us. And not forgetting my two boys, Emmanuel and Anakwesi. So, and my number is 0546 546132. Again, 0546 546132.
Okay.
How
If
can
you
I
have
forget?
anyone to
How can I forget my own bestie, Linda Bonsu? I want to send you love messages. I love you so much. My roommate, my sister Harriet Isel. Thank you so much for everything, being with me, the care and everything. I can never forget my supposed lover, Michael Ajati. I love you so much. I will continue to love you no matter what. And to my baby bestie, Howard, how can I forget you too? Thank you so much for everything, for being with me, for the sacrifices and everything. I love you, mommy. I love you, daddy. Thank you so much for watching.
All right. this is where we end today's show on Gym Matters Arising Health is Crucial. As I told you, today we discussed occupational therapy. And I will say once again, our sponsors are Danfote Computers and Electronics. They deal in computers, all type of computers you need, whether desktop computer, laptop computer, or even computer accessories. You call them or you come to their place at Bombay bus stop on the Dakoma Road. You get a computer to do your business or whatever you are doing. So you can call Danfote Computers and Electronics on 0246189703, 0246189703. Also, G Opera Guest House. When you are in Kumasi and you need a best place, best guest house to sleep, where you feel so comfortable, where you get a comfortable bed to sleep on, and their room sizes are very huge with air conditioning and all the necessary things you need to be comfortable at home. You can call Gino Ferreira Guest House on 0596 098 359, 0596 098 359, or 0596 000 652, 0596 000 652. J Overia Guest House is the best place. And also JA Hair Palace. JA Hair Palace, those in beautician, anything concerning beautician, they are into it. They do hair braiding and everything. I mean, makeup, nails, and everything. They are located at Sotium Amanjo Pharmacy Junction. You can call JA Hair Palace on 0270 751 9050 270 751 905 or 0245 825 Also, happy birthday to Asare Yabua Daniel, aka Bishop in Koforudia, my brother. Happy birthday. May God bless you and grant you all your heart wishes. Also, happy birthday in advance to Niaite's grandma. That's Madam Mary Akuyi Okain. Of Adedingpo. Yeah, All Nation Christian Center. So happy birthday, mommy, to you in advance from your son, Ni Aite. God bless you so much. So this is where we end today's program. As I said, blessing, medical nurse, greetings to you. God bless you so much. And today, technically, we were produced by Emmanuel Boache, aka Street Code, and also Kakra. Kakra also was here to control the camera for us. So today, this is where we end today's program. Next week, we will be here with another topic and another segment. So we end today's program here. We love you so much. My name is Nelson. Next week, we will meet. Bye-bye.
Ano kwa momien kana yadeɛ yɛntine ni sɛ wotena ma yadeɛ bi bɛto ansa na wapɛ yadeɛ ho nimdeɛ wentine wasa wogye brɛ na hwɛ health is crucial dwumadie a Gym Matters Arising akɔfa ba ukuada bia nonson ekopem no nwɔtwe mekyerɛ every Wednesday 7 to 8 p.m. ɛwɔ Gym Matters Arising Facebook page dwumadie isu ne yɛde apomudin dwumayɛfo a wakwadre wɔ apomudin mu bɛkyerɛkyerɛ yare ahodoɔ ne ano yie ɛno nti ɔdɔfo gye brɛ ne nyina yɛ mmom nsuadeɛ wɔ health is crucial dwumadie so na ɔbɛfo apomudin to mafra